This video is an update on the status of the COVID-19 virus pandemic, also known as the coronavirus. In this video, I'll give you some statistics that'll help you understand how dangerous COVID-19 may be and why there are such strong restrictions on travels and gatherings.
Dr. Terry Shintani, Director of Preventive Medicine at Sewanee.
Hi, this is Dr. Shintani for your health. For tips on how to protect yourself from the COVID-19 virus, subscribe to this channel and click on the bell for notifications for further updates and tips on how to stay healthy, and look for the previous video on 10 ways to protect yourself from the COVID-19 virus. A lot has happened in the week of March 8th to March 15th. On March 11th, the World Health Organization declared the COVID-19 a pandemic. Most major sporting events have been postponed or canceled, and on March 13th, President Trump declared a national emergency. On March 15th, the CDC recommended that for the next 8 weeks, organizers cancel or postpone in-person events that consist of 50 people or more throughout the United States. They recommend that when feasible, organizers should modify events to be virtual. President Trump has even suggested that no meetings of over 10 people should be held for now. Meanwhile, many schools and universities are shut down and gone virtual already, and many cities are ordering the temporary closing of restaurants and bars. How dangerous is the COVID-19, and why is there so much concern over public gatherings? Dr. Anthony Fauci, director of the National Institute of Allergy and Infectious Disease, says that COVID-19 is 10 times more deadly than the common flu. Actually, the death rate is low for young people, but rises with age. The mortality steadily rises to a point where for people over 80, it's around 150 times more deadly than the common flu. But that's not the whole story. Because the course of this disease can include sudden, severe shortness of breath, it can cause symptoms so bad that many will require hospitalization and ventilators to survive. Unlike the flu, this can put a huge burden on hospitals and hospital equipment. Italy is probably the worst example of this happening. The number of cases multiplied so rapidly in Italy that urgent care and emergency care facilities were overwhelmed. What's worse is that they ran out of hospital beds and ventilators, and they were faced with impossible choices as to who would be given life-saving treatment and who would not. If you think this can't happen in the U.S., you better think again. The U.S. Surgeon General, Dr. Jerome Adams, points out that we are where Italy was 2 weeks ago. In other words, if we don't do something now, in 2 weeks, we may have the same crushing problem Italy has now. This is what he means. If you look at these graphs, you'll see why there is so much concern. At first, when you compare U.S. case rates in blue compared to Italy's case rates in red, it looks like the U.S. is doing very well. But if you frame shift the Italian numbers just 14 days forward, you'll see that the new case rates matches that of the U.S. fairly closely. This suggests that if we do nothing about curbing the spread of COVID-19, by March 24th or so, we can expect 25,000 cases in the U.S. based on the Italian experience. In terms of death rate, on a day-by-day comparison, again, the U.S. looks like it's doing much better than Italy. But if the rate of spread turns out to be similar to that of Italy, and we frame shift the rates forward about 12 days, we can expect over 2,100 deaths by March 28th. And if you think we can handle that number of cases better than Italy, because we're a country with over 5 times the population and 5 times the number of hospitals, just follow the numbers. It looks like it takes just 7 or 8 days to increase 5-fold in numbers of cases and deaths. So it began to look like the horror story of Italy was about to play out in the U.S. This is a major reason why the president declared a national emergency and why the administration, the CDC, and the Surgeon General called for a general shutdown of crowd gatherings to prevent the potentially catastrophic outcomes as it is happening now in Italy. So don't panic, be prudent. For the sake of yourself and others in your community, and so that the rates don't rise dramatically as it did in Italy, be aware that even if you're in a low-risk category, you don't want to be a carrier and pass it on to someone who is at high risk. This is especially true for the senior members of our families and community, including parents, grandparents, and older relatives. So please observe the recommended travel and social restrictions and use the 10 ways to protect yourself that I described in my last video. Doing so will help protect you, your family, and your community from COVID-19, and at the same time will protect you from the common flu. For more tips on the COVID-19 virus and how to stay healthy for 120 years, subscribe to this channel and click on the bell for notifications. This is Dr. Shintani for your health.